Hey everyone, Dr. Alex Ritza here. I've got a short video for you today, guys, in some new digs. So I'm taking care of two patients right now who came to see me primarily for having outer elbow pain. And in both of these cases, we have found that their elbow pain is related to their spine and their nervous system, like most cases are. Lots of work out of Australia from a researcher, Vincenzino, showing that there is a strong nervous system connection between elbow and neck. So with both of these patients, we've been seeing them now for a couple of months. They've done really, really well. In both cases, we've had resolution down to like 2 to 5% disability and 2 to 5% pain. They've done really, really well. And we've talked about their ergonomics. We've given them rehab exercises. We've really made sure that they're minimizing the amount of strain on their elbow. And so we've done that by giving them the right homework and making sure that when they're on their computer, because both work in office jobs, they have minimal strain on the elbow, on the radial nerve down to the elbow, and on the neck. Three things that need to be addressed in a case of elbow pain. But despite that, between visits, we see that it keeps recurring more than I would expect, given the health of their spine and given how much we've minimized the amount of strain that should be on the elbow. And so what we have discovered is that when these patients are moving, they're moving in a way that is putting too much force on the elbow. And the way that we found this out the most was with a bent over row. So when I demonstrated this exercise to try and build more scapular strength, scapular stability, shoulder stability, so that the forearm didn't have to do as much work, when I do this in slow motion, I raise the arm up and then I bring the hand back. So I have my core braced, and then you can see the first thing I do is I move my shoulder and shoulder blade, and then I move my arm. I do not do this and then bring it back. But with both of these patients, we noticed they did this first. And then the elbow came back, then the shoulder blade came back. So obviously not a randomized control trial, but my thought process on this is that if they're doing this supervised in the office, then what we can probably expect is when they're going about their day, they're probably really favoring and using the muscles of the forearm, smaller muscles than these big scapular stabilizers like the trapezius, like the rhomboids, like the rotator cuff muscles. And they're putting more force through the elbow instead of using these bigger muscles. And so if they're doing that with this, they're probably doing that with most things in their life. And even if I'm wrong, this exercise is still going to help them with this, but I have a strong suspicion that their pain, their problem keeps coming back despite a healthy spine, despite a healthy nervous system, but despite doing everything right, it's just that they're not moving properly. It's putting more strain on the elbow than there should be. So the big takeaway from today is if you are an elbow pain sufferer and you've been getting good treatment, you've been getting good care, you've dealt with the neck, you've dealt with the spine, you've dealt with the nerves going down to the elbow, you've rehabbed the elbow, but it keeps coming back. We want to make sure that when we're moving, we use the bigger muscles over the forearm muscles. And so this bent over row is a great way to train this. And what I have my patients doing is trying to keep the arm completely straight and just work on retracting the shoulder without bending the forearm or minimizing the bend. We want to exaggerate that shoulder retraction without using the forearm so that when they go to do it in real life, this will happen first and then they will do this. So if you are suffering with this, I would say work on changing the way you move, your movement pattern, to favoring those bigger muscles in the shoulder blade, working on retracting the shoulder so that you're not just using those elbow and forearm muscles, creating strain all day, every day. It's going to keep this issue coming back. That's all I got for you today, guys. Small, but I think a really, really, really big thing, especially if you have recurrent elbow pain. The bent over row is a great way to train this. Try it for a couple of weeks. If it doesn't help, go back to see your manual therapist or go see a manual therapist in the first place. I'm signing off. I got company coming over. Take care, guys.